Hello everyone, welcome to my YouTube channel. So today we are going to look at biomedical scientist job interview in histopathology. Hopefully we are going to find the presentation interesting. So what I've done was to pick few questions, I think about 2 of them, so that we can go through. Before we continue, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. Now, let us look at the first question of what I picked up. Number 1 is, list some differential diagnosis for skin tumors. So what it means that they want you to, if you know what skin tumors is, okay, so meaning there's a growth in the skin, or as the case may be, what it means is that they want you to list, possible causes, some possible condition that can mimic skin tumor. So list some differential diagnosis for skin tumor. So now let us look at the detail of that. What exactly is really differential diagnosis? Because I think that this question is likely to be confusing if you don't understand the word differential diagnosis. Okay. So in terms of differential diagnosis, you're looking at a list of possible conditions that share similar symptoms. In other words, because we are looking at the differential diagnosis in skin tumor, so you are looking at all those possible conditions that mimic, or that have similar symptoms as that of the skin tumor. So that is what differential diagnosis is talking about. Okay, so it's looking at possible conditions that share similar symptoms of whatever thing you want to determine. Now, what it means is that even the list I'm going to produce here or going to give you here is not the final list, as the case may be. There can be more, but it's just to make it comprehensive. So now let us look at the overview. In terms of the overview, we are not going to look at it, we need to look at the fact that, in order to look at that differential diagnosis of the skin tumor, it's important that we know that proper diagnosis of skin tumors involve clinical examination. So if we really want to diagnose a skin tumor, we need to do a clinical examination, and we need to look at dermoscopy. In other words, using a microscopy that can use to examine the skin, as the case may be. Then we also need to do other histopathological evaluation, as the case might be. So again, still in the overview, it is crucial then to be able to do a differential between whether it is benign tumor or pre-malignant tumor or malignant tumor. So you need to know that in histopathology, of course, once there's a tumor, once there's any growth, the question you then need to ask yourself, this growth that you are seeing in any part of the body, but on this occasion is the skin, you need to determine, is it benign? In other words, is it non-cancerous, okay, or maybe non-harmful, or is it malignant, meaning it is cancerous or harmful, as the case might be. Okay, so it is important that once you see there's a growth, if you want to, in the diagnosis, you need to determine first, is that growth benign or is it malignant? Now, still in the overview, I want us to look at the fact that when considering the differential diagnosis of the skin tumor, it is essential to recognize that the skin tumor can arise from various cell types, okay, and that may be either benign, like I've said, or malignant. So you can see it in different types of the cells, and whichever way you see it, whichever where you see it, okay, or location where you see it, it could be malignant or it could be benign. So it's important that we determine which way or which direction is that growth taken on. Is it taken towards the benign tumor or malignant tumor? Now let us look at the benign tumor as example. So we already know that the question is talking about list differential diagnosis of the skin tumor. So we already know that in the skin tumor, it could be either benign or malignant. So it's important that you might need to let them know that these are some examples. Okay, so you have seborrheic keratosis. Okay, and then another one is lipoma. Okay, then you have what you call dermatofibroma. Okay, these are the different types. Okay, so just as the list might go, you have cherry angioma, okay, and so on. Then you have epidermoid cyst, okay, epidermoid cyst. So these are different types of the benign tumor. Now let's look at the pre-malignant tumor. That means the one that are likely to develop to malignancy. Does that make sense? Then you can have actinic keratosis. Okay. Now after that, you can have what you call Bowen's disease. Okay. Then let us look at malignant skin tumor itself. Okay. Now you are going to hear the word marker cell carcinoma. Okay. So I'm just giving you some of the examples. You might need to read them up. Okay. So you have marker cell carcinoma. Then you have cutaneous T-cell lymphoma, okay? Then also you have what we call squamous cell carcinoma. Does that make sense? So these are the kind of different types of the malignant tumors, as the case might be. Then you also have what we call basal cell carcinoma, okay? Then after that, have what we call melanoma, okay? And these are also example of malignant skin tumor. Now, let us look at other things that we might need to consider, okay? So the other consideration could be what we call metastatic tumor, okay? Then it can also be what we call Kaposi sarcoma. So these are different, other type of the similar, that may have a similar condition, similar symptoms as that of the skin tumor, which may be or may not be malignant, as the case may be, okay? So now let us look at non-tumorous condition, okay, mimicking tumor. So there are some non-tumorous condition, that means, but it mimic tumor, okay? It might mimic something that, you think that is what it is, like cancerous, but it's not it. So you can look at something like granuloma annulare, okay? Then you can look at keloids, okay? Genic granuloma, okay? So now, once you have known this, before we go to the question number 2, what I want you to then know is that if you do get such a question that said, list the differential diagnosis of the skin tumor, you need to first of all tell them what differential diagnosis means, link it to the fact that, they may share, these are the diagnoses on this occasion that share similar symptoms as that of the skin tumor, okay? And that of the skin tumor could be either benign tumor or premalignant tumor or malignant tumor. Then you can now give example of the maybe benign tumor, premalignant tumor, and malignant tumor, and that way you've been able to answer the question. I hope that makes sense. Now, the next question we're going to look at is what control is used for the ABPAS special stent? What control is used for the ABPAS special stent? So the question now is, what exactly is AB and what is PAS? So these are the two different types of stent, by the way. So that the AB, means something else, and PAS means something else. Does that make sense? So when we talk about AB, you are looking at Acid blue. When you look at the PAS, you are looking at periodic Acid-Schiff, okay? So that's why we call it AB pass, okay? Acid blue periodic Acid-Schiff. So these are special stent, and what this special stent does, that it is a differential stent. Are you getting me? Meaning that the Asian blue will stent something different, okay, and give you a different coloration, give you a different property of a particular cell, while the periodic Acid-Schiff will show you another type of property of a cell. So that is why I say that it is a special stent, is a differential stent that differentiates between acid, okay, and the neutral. So it differentiates acid mucin and neutral glycogen. Does that make sense? So that is what it does. Does that make sense? Remember, we are looking at what control can be used, what control is used for the ABPS special stent. So what it is that, at which point can we, if we are trying to do examination where we want a differentiation of the mucin, okay, acid mucin, and that of the neutral glycogen, okay, if we want such differentiation, what are the likely kind of biological sample we can use? Remember, in all the laboratory departments, in every part of the laboratory, okay, including in histopathology, every test you do, there has to be a control. Basically, it's asking you, at which point can we use this ABPS for a control? So when we're going to use it as a control is when, because we know that ABPAS is a differential stent. So because it's a differential stent, we are going to use it when we want to find a different properties as in line with what it can differentiate. And what it means is that if we are going to do that kind of examination, we then need to find a sample that contains what ABPS can be used to differentiate. I hope that makes sense. Okay. So now, if you look at that, for these 10 techniques, the appropriate control tissue should contain both the types of the substance. That's what I just said. So if we're going to do this test, we then need, a sample that contains what this can be able to differentiate, what ABPS can be able to differentiate. I hope that makes sense. We already see from the definition that what it does is a special stent that differentiates between the acid mucin and the neutral glycogen, okay, which is where you can get maybe mucopolysaccharide. So what it means is that we now need a sample that can contain this mucin and glycogen, as the case may be. I hope you understand that. So that way it can be able to differentiate the acidic content of that sample and also from the neutral side of the sample. Now, let us look at the recommendation of the control tissue. So in these ABPS control samples, the sample we recommend that we should use are the sample, like I've said, that will contain these two things that can be used to differentiate. Number one is small intestine. So small intestine can be used. Why do we need to use small intestine? We use small intestine because small intestine is often used because it contains goblet cells, and this goblet cell produces acidic mucin. So, and this acidic mucin will then be stained by what? Asian blue. Remember that the Asian blue will stain the acidic mucin, okay, while the PAS will then stain glycogen, okay. So now what it means is that with this small intestine, it has goblet cells, and the goblet cell produces acidic mucin, okay, which is going to be stained by the Asian blue, and also it contains glycogen, and this glycogen is going to be stained by what? PAS. I hope that makes sense. That is past. Now, another sample we can use is what we call colon. The same thing is applicable. Colon also contains what we call goblet cells, okay? So the same thing will happen, okay? It contains goblet cells, meaning that it can produce both acidic mucin and glycogen. So remember, I keep telling you, mucin will be stained by what? The AB, which is Asian blue, while the glycogen can be stained by what? PAS. I hope that makes sense, okay? Now, let us look at recommendation of, still in the recommendation of that. Then another sample can be appendix, okay? So the appendix on its own contain also both acidic mucin and neutral mucin, okay? It contains acidic mucin and it contains neutral mucin. So meaning that it has two types of mucin. One is acidic, one is neutral, making it a good control for what? ABPAS. So what it means is that the acidic mucin is going to be stained by the AB, while the neutral mucin is going to be stained by what? PAS. I hope that makes sense, okay? Let us look at the key observation of what we can see when it comes to that. So when it comes to the Asian blue, you are going to see that whether it is in terms of the such found in goblet cells or maybe acidic mucin, as the case may be, okay, is going to stain it what? Blue. While when it comes to the periodic Acid-Schiff, what is going to happen is that it will stain the neutral mucin or glycogen or other positive substances. It's going to stain it to what? Magenta / what? Maybe pink, okay? So it can stain it to pink or magenta. Does that make sense? Now, before I conclude this, I want you to actually know that. So what it means that the control, when such question comes, you need to first of all tell them what ABPS means, okay? It's a differential stain. So AB is going to stain the acidic mucin, while that of the PAS is going to stain neutral substances like maybe neutral glycogen or neutral mucin, as the case may be. So if we want to carry out such test, we need to use a sample that contain this acidic part and also the neutral part, as the case may be. I hope that makes sense, okay? So that is where we now talk about something like small intestine, we talk about colon and appendix, and mention the cells that they contain, and the one that AB is going to stain, and the one that PAS is going to stain. So conclusively, using this tissue ensure that both staining components, both the Asian blue and what PAS, are effectively demonstrated. Why? Because it will help in verifying the stain's reliability and accuracy for the diagnostic purposes. Remember, if you want to differentiate the acidic content and also the neutral content, what it means that you need a control that can be able to do that thing. So that means there has to be already a sample that we know that contain it. Because if we don't have such a positive sample, how do you then determine that your test is accurate or not? I hope that makes sense. Yeah. Anyway, thank you for listening. I hope you find this presentation very interesting. Please, can I ask you to subscribe, share, like, and comment? Thank you till I come back your way again. Bye-bye.